Thanks for joining Family Caregiver Alliance for MediCare Basics. I'm Calvin at FCA and your host for today. For over 4 decades, FCA has been working across the Bay Area and the nation to improve the well-being of family caregivers. We offer support through consultations, classes, publications, research, and advocacy. If you'd like to learn more about us or access our online resource center, CareNav, please visit us at caregiver.org. Now, during the webinar, your phones or mics are going to be muted. So if you have any questions, you can ask them using the Zoom Q&A box. We will answer as many questions as we can at the end of the webinar. Now, today I'd like to welcome our guest, Maxwell Arno. Maxwell joined the Medicare Rights Center in 2022 as Coordinator of Volunteers and Outreach. He comes from an arts literacy background where he adapted children's books into plays and integrated the arts into the Common Core curriculum to enact new educational strategies in New York public schools. Max graduated from Tulane University with a Bachelor of Arts in English and History and an MFA in Acting from West Virginia University. Max has a long-standing commitment to helping underserved communities develop critical literacy skills and is renewing that commitment in the field of healthcare advocacy. And now I'd like to turn it over to Max.
Hello. Thank you so much for having me. It's a pleasure to be a part of this presentation. Today we're going to talk about Medicare Basics. I'm from the Medicare Rights Center, and we're based in New York City. And we provide education and as well as advocacy for people who are hoping and looking to navigate Medicare and understand the terrain of Medicare, which can be very complicated. Just one moment, please. Okay, let's get started. So the Medicare Rights Center is a national non-for-profit consumer service organization that works to ensure access to affordable health care for older adults and people with disabilities through counseling and advocacy, educational programs, and public policy initiatives. Now, as Calvin said, you can use the Q&A to ask questions. You hover your mouse near that Q&A webinar window and click the Q&A button, and then you can type in your question. And as Calvin said, he'll get to as many as we can at the end of the presentation. Here's an example of how that might work and how it might look. Subtitles are enabled. So if you want to see the writing on the screen, you can click the CC button at the bottom of the screen that says Show Subtitle. And you can click the chat button if you have any technical problems. And hopefully Calvin will be able to help you with that. What we will learn today, we'll learn about Medicare eligibility and enrollment, original Medicare and Medicare Advantage coverages and costs, and Medicare Part D drug benefit. So, Medicare Basics. What is Medicare? It's a federal program that provides health insurance for those 65 plus, those under 65 receiving Social Security Disability Insurance, or SSDI, for a certain amount of time, and those under 65 with kidney failure requiring dialysis or transplant. There are no income requirements to getting Medicare. There are two ways to receive your Medicare benefits. One, original Medicare. It's a traditional program offered directly through the federal government. Or Medicare Advantage, which is a private plan that contracts with federal government to provide your Medicare benefits. The parts of Medicare. Medicare benefits are administered in three parts. Part A, which is the hospital inpatient benefits. Part B, doctor or outpatient benefits. And Part D, the prescription drug benefit. Original Medicare includes Part A and Part B. The Part D benefit is offered through standalone prescription drug plans. Now, what happened to Part C? Part C is Medicare Advantage, such as an HMO or a PPO plan. The ways to get Part A, B, and D are through one private plan. So if you get Medicare Advantage, it will be Part A, B, and D are all bundled together in one plan. And it's administered by a private insurance company that contract with the federal government. It's not a separate benefit. Everyone with Medicare Advantage still has Medicare. So if you get Medicare Advantage, you're getting Part C. Medicare eligibility 65 plus. After turning 65, an individual qualifies for Medicare if they collect or qualify to collect Social Security or railroad retirement benefits, or are a current U.S. resident and either a U.S. citizen or a permanent resident having lived in the U.S. for 5 years in a row before applying for Medicare. Note, those who are immigrants can qualify for Medicare as long as they meet residency requirements. Medicare eligibility under 65. Individuals not yet 65 qualify for Medicare if they have received Social Security Disability Insurance, SSDI, or Railroad Disability Annuity checks for total disability for at least 24 months. If they have amyotrophic lateral sclerosis, or ALS, there is no waiting period, and they are eligible for Medicare when they start receiving SSDI. Or they have end-stage renal disease, ESRD, or kidney failure, and they have they or a family member have enough Medicare work history. Qualifying for premium-free Part A. Part A is free for Medicare-eligible beneficiaries who, 1, have at least 40 calendar quarters or 10 years of work in any job where they pay Social Security taxes in the U.S. 2, are eligible for railroad retirement benefits. 3, have a spouse that qualifies for premium-free Part A under 1 or 2. Note, differences between current spouse, married 12 months, ex-spouse, single, and had been married 10 years, and deceased spouse, single, and had been married 9 months. Beneficiaries who are Medicare eligible but do not meet any of the criteria above must pay a monthly premium for Part A. Enrolling in Medicare for the first time. Automatic enrollment. Someone will be automatically enrolled in Medicare Parts A and B and mailed a Medicare card if they have enrolled to receive Social Security benefits before they turn 65. They have a disability and have been receiving SSDI for at least 24 months. Or they're getting SSDI because they have ALS. People with ALS are automatically enrolled in Medicare the first month they receive SSDI benefits. First-time enrollment periods. If someone is not automatically enrolled in Medicare, they can enroll for the first time during the initial enrollment period, or IEP, the Part B special enrollment period, or Part B SEP, or the general enrollment period. Initial enrollment period, IEP. 7 months period, including the 3 months before, the month of, and the 3 months following a beneficiary's 65th birthday. The coverage starts depending on where in an IEP a person enrolls. So, this enrollment period is revolving around your 65th birthday. If you were born at any day in January, your birth month is January. And then you have 3 months before January and 3 months after January to still enroll in Medicare during your IEP. Part B special enrollment period. The Part B SEP starts when an individual has coverage from current work, job-based insurance, and they are in the first month of eligibility for Part B. So individual does not qualify to use Part B SEP based on retiree coverage or COBRA. So if you are to delay enrollment in Part B because you're still working, when your job insurance ends, your Part B SEP begins. The Part B SEP is 8 months after the individual loses coverage from current employment because employment or insurance ends. So let's say you worked up until age 70. When your insurance ends, you will have 8 months from that time to enroll in Medicare. And that's your Part B SEP. Using the Part B SEP also means an individual will not have Part B late enrollment penalties. We'll talk more about late enrollment penalties in future slides. Using the Part B SEP, the individual must meet 2 criteria. 1, they must have insurance from current work, from their job, their spouse's job, or sometimes a family member's job, or have had such insurance within the past 8 months. 2, and they must have been continuously covered by job-based insurance or Medicare Part B since becoming eligible for Medicare, including the first month they became eligible for Medicare. Note, individual is ineligible for the Part B SEP if they are without Part B or job-based insurance for more than 8 consecutive months. In most cases, the individual should enroll in Medicare before losing job-based insurance to avoid gaps in coverage. Okay, so now we're moving on to the third way that you can enroll in Medicare. We've talked about the IEP. That's the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after it. That's the IEP. The SEP is you work after you're 65 and you decide to retire years after that. Your SEP is 8 months after that employer insurance ends. That's your SEP, your Part B SEP. That's the second. And now the third is the general enrollment period, the GEP. If someone who is eligible for Medicare misses their IEP or SEP, they can enroll January 1st through March 31st of each year. In 2022, the coverage would start July 1st. So there's a large delay if you use the GEP. However, beginning in 2023, coverage will start the first of the month after the month of enrollment. So you only need to wait until the next month. That has been fixed. That has been amended. Note, people who use the GEP may also have a Part B late enrollment penalty. The penalty is 10% of the Part B premium for each 12-month period without Part B or certain types of other coverages. So you had to have been late for a year to get the Part B late enrollment penalty. And if you do have that penalty, it's 10% of the Part B premium, which right now is $170.10. So it'd be 10% of that each 12-month period that you were late. And it would be added on to your premium, and you would pay it every year until the end of your life. Medicare coverage and costs. What Part A covers? Inpatient hospital care. Care provided to someone who is formally admitted into the hospital by a doctor. So you would have to, sometimes you might go to the hospital and you're just under observation. You never get admitted. That is not going to be covered by Part A. You must be formally admitted into the hospital. inpatient skilled nursing facility care. So if you were to fall and hurt yourself and then go into a rehab, that's where Part A would cover. Home health care is care used to treat an illness or injury in the home. Part A covers that, but that is specifically for skilled care. So helping you recover from injury. It wouldn't be long-term care, such as helping you cook or clean or helping you get to the bathroom. That's all under a totally separate category, not covered by Medicare. Or hospice care, comprehensive care for people who are terminally ill. So that is what's covered in Part A. Part A costs for 2023. The premium, it's free for those with 10 years of Social Security work history. So if you've worked for 10 years and you've paid Social Security taxes, your Part A won't cost anything per month. However, if you only have worked for 7.5 to 10 years paying into Social Security, then your Part A would cost $278 a month. If you have fewer than 7.5 years of work paying Social Security tax, it would cost $506 a month for Part A. There's a hospital deductible, and those of you who know this, the deductible is how much you need to pay before insurance starts to cover. So the hospital deductible is $1,600 for each benefit period. And a benefit period is the period of time for each coverage period when you're hospitalized. The hospital coinsurance is $400 per day for days 61 to 90 in each benefit period. And the hospital coinsurance is $800 per day for days 91 to 150. And these are 60 non-renewable lifetime reserve days. So benefit period is 60 days. So once you exceed 60 days in the hospital, that's why this is indicating $400 per day. And once you exceed 90 days, then it comes up to $800 per day. Skilled nursing facility coinsurance, $200 per day for days 21 to 100 in each benefit period. So if you were to fall and hurt yourself, and then your doctor sends you to a skilled nursing facility, the first 20 days, there would be no coinsurance. Part A would cover the entire time. But after day 20, it starts to cost per day, $200 per day. What Part B covers? Outpatient care. Care provided to a beneficiary by healthcare professionals if they were not formally admitted as a hospital patient. So doctor's visits, you go in for a procedure. This is Part B. Doctor's services, medically necessary services provided to a beneficiary by a doctor. Preventative care, care to keep beneficiaries healthy or prevent illness. Home health care, care used to treat an illness or injury in the home. And durable medical equipment, or DME, medical equipment provided to beneficiaries on an outpatient basis. So that would include wheelchairs, walkers, or certain types of equipment you might need to administer your medicine, for instance. Part B costs for 2023. The annual deductible is $226. So that for the entire year, you're going to have to spend $226 before Part B starts covering all the things it's meant to cover. There's a monthly premium. It's going down from $171 to $164.90. So each month, you will pay $164.90 for your Part B. And people with high incomes pay more for the monthly premium. And that's called an IRMA, an income-related modified allowance. No, IRMA stands for income related monthly allowance. Yes, IRMA. So there's a whole graph provided by Medicare that explains what the different income brackets are for a level of an IRMA. So if you make past a certain amount of money, then that IRMA goes up based according to that graph. Coinsurance. Medicare pays 80% of Medicare approved amount for a doctor's service, and the beneficiary pays 20% coinsurance. So under Medicare Part B, 80% of all of your health care is covered, but you are responsible for 20%. What Medicare does not cover: most dental care, most vision care, routine hearing care, most foot care, most long-term care, most alternative medicine, most care received outside the U.S., personal care or custodial care if there is no need for skilled care, and most non-emergency transportation. Note, Medicare Advantage plans or Medicaid, if a beneficiary qualifies, may cover these services. Okay. Medicare drug coverage, Part D. Medicare Part D. Outpatient prescription drug benefit for anyone with Medicare. An individual is eligible for Part D if they have Part A or Part B. It's only available from private insurance companies. So when you get Medicare, you get Part A and B through the federal government, but you need to go through 1-800-MEDICARE or Medicare.gov to sign up for Part D. And that would be a prescription insurance you would get through United or Aetna or Cigna. Any of those kind of companies would be able to give you Part D. And you will sign up for them through Medicare, and it will be part of your Medicare coverage. Individuals can get Part D coverage in two ways: standalone Part D plan that works with original Medicare. That was the example I just gave. You just got your Part A and B through the federal government, and then you go through Medicare and you sign up for Part D. You pick whichever one you want. Or you can go get a Medicare Advantage plan, and that will include prescription drug coverage most of the time. So if you chose a Medicare Advantage plan, you would pick, I want it through Blue Cross Blue Shield. I want it through Cigna. I want it through Aetna. I want it through United. And that Medicare Advantage plan, most all of the time, will have a Part D plan in it, part of it. And it's all administered by the same company. Beneficiaries can enroll in a Part D plan during their initial enrollment period after taking either Part A or Part B. So you have that 7 months, remember we talked about? You have your 65th birthday, the 3 months before, and the 3 months after. During all of that time, you can enroll in Part D once you've signed up for Part A or B. They can also enroll in Part D for the first time during fall open enrollment, but they may have a late enrollment penalty. And we'll talk about how Part D late enrollment penalties work. Part D coverage. Each Medicare drug plan has its own formulary or list of covered drugs. The plan only covers drugs on the formulary. Plans must offer at least 2 drugs under each type of drug class. Plans must cover substantially all drugs from a few classes. A few classes of drugs are excluded from Medicare coverage by law. So when you're signing up for Part D, if you're using Medicare.gov, they have a plan finder tool, and they will ask you to put in your drugs that you take, and it will automatically steer you towards plans that have all those drugs on the formulary so that you will have the least expense per year. but you should also always check to make sure your drugs are covered on the formulary. Part D costs. Each plan charges different premiums, deductibles, and copays. The national average premium is $33.37 in 2022. Will go to $32.74 in 2023. That national average is used to calculate a person's Part D enrollment penalty, which is 1% for every month that a person goes without Part D coverage or creditable drug coverage. So let's say you're in your IEP, you sign up for Medicare, and you get Part A and B. And then 6 months go by from the end of your IEP, and you realize, whoops, I never got Part D. Well, your time to sign up was 2 months. Oh, sorry, that's for an SEP. You've gone out of your IEP by 6 months, we said, right? So that means 6% of 33 or 3274 in 2023, 6% of 3274 will be your penalty. Now, because the national average premium is only $32, when you're taking a small percentage of that, it's not going to be that high. But if you didn't sign up for Part D for years, and some people don't, then that penalty is going to be a lot higher. But that is how it's calculated. It's 1% for every month that you don't have Part D coverage, and they use the national premium average to calculate it. Prescription copays vary. Pay less for drugs in lower tiers. For example, the structure could be Tier 1, generics. You pay the least for generics. Tier 2, preferred name brands. Now the expense goes up. Tier 3, non-preferred brand names. And Tier 4 and above, specialty drugs. So specialty drugs would be something like a very expensive anti-cancer medication, or something that has recently come out that is extremely expensive and extremely new. Those higher tier drugs can be very costly. Part D costs. Beneficiaries may also have different costs throughout the year, depending on which coverage period they're in. Part D coverage periods. Number 1, the deductible period. So, like we said, a deductible is how much money you have to spend before the insurance starts covering. So if your Part D has a $500 deductible, you have to spend $500 before your drugs start to be covered. So that's the deductible period. 2 is the initial coverage period. You've paid the deductible off, and now the insurance is covering all of your drugs as it's supposed to. You're going to have a small copay probably, but that's it. And then if you have a certain amount of money that has been covered and a certain amount of money that you have spent, you enter in something called the coverage gap. It's also called the donut hole. And when you get into that period, you are responsible for 20% of the total cost of the drugs. And so your expenses will go up. It will get expensive in the coverage gap until you reach another step. And after you've paid a total amount of several $1,000s, I want to say, I'm not going to quote it, but I have a flyer that I can send all of you about what the exact dollar amount it is. But after you've paid that dollar amount in the thousands of dollars, you go into catastrophic coverage. And when you're in catastrophic coverage, you pay like 2% of all of the cost. So then at that point, your expenses go down to very little. Okay, now we're going to talk about a comparison between Original Medicare and Medicare Advantage. Remember, those are the two options you have when you first enroll in Medicare. Original Medicare, overview. Coverage includes Part A, as we said, that's hospital insurance, and Part B, which is medical insurance, outpatient. Drug coverage available through standalone Part D plan. Remember, you got to go to 1-800-Medicare or Medicare.gov and sign up for that prescription plan. It does not cover certain services such as routine dental care. Provider access. There are no network of providers. You can receive covered services from any provider in the U.S. who accepts Medicare. So if you live half the year in Nevada and the other half of the year in Arizona, you can go to any doctors in Nevada or any doctors in Arizona and get the same coverage. Referral requirements. No primary care physician referral for a specialist. So if your doctor, if you need to get an X-ray or if you need to get a CT scan, you don't need someone to write you an order for that. You don't need permission. If it's covered by Medicare, it's a covered service. Costs. No limit on out-of-pocket costs. You can purchase a Medigap policy to cover Medicare cost sharing. And we're going to talk about Medigaps next. Okay, Medigap policies. These are also called supplements. So if you hear someone talking about, I have original Medicare with a supplement, that's what we're talking about, Medigaps. They're the same thing. Supplemental plans that pay part or all of remaining costs after original Medicare pays first. For example, a Medigap policy can pay for an individual's 20% Part B coinsurance. So remember how we said that under Medicare, 80% of your hospital bill is covered by Medicare, and you're responsible for 20%. Well, the Medigap would pay that 20%. And in some cases, it would also pay the deductible and many other costs that would come up. They only work with original Medicare. So you can't get a Medigap with Medicare Advantage. It only works with original Medicare. There are 10 standardized plans, and they go by letter. There's plan A, B, C, D, F, G, K, L, M, and N. Now, beneficiaries who are newly eligible for Medicare on or after January 1st, 2020 cannot purchase Medigap Plan C or Plan F. But there are other plans that are equivalent to those plans, very similar to them. Those eligible for Medicare before January 1st, 2020 can still purchase Plan C or Plan F if they are in their Medigap open enrollment period or have a guaranteed issue right. Medigaps are provided by private insurance companies, and they charge a monthly premium for coverage. So let's say you get original Medicare, and you decide you want to get a Medigap. You would need to go and pick your Medigap. They're all the same based on letters. So each letter provides a certain type of care. So you pick which letter you want, and you go and you pick which insurance company you want to provide your Medigap. And you start paying them monthly for that. So you have a premium from your supplement. And then that supplement pays the extra costs associated with Medicare, original Medicare. Medigap basic benefits. All 10 plans cover Part A hospital coinsurance. So that includes the full cost of Medicare covered days in a benefit period, and the full cost of 365 additional lifetime days. Remember how we said if you went to the hospital and you were there after 60 days? Well, then this could help cover some of those extra days, and it would keep you from spending all that extra money. And remember we said that you have to pay a deductible in every benefit period? Well, this would cover that deductible. The Part B coinsurance. Remember we said that 20% extra, it also covers that. The cost of blood. So a part or all of the cost of the first 3 pints of blood needed each year. And hospice care coinsurance. The full cost of hospice care coinsurances if Medigap was purchased on or after June 1st, 2010. Some Medigaps also give you extra days in that skilled nursing facility and pay that extra cost. Remember how we said that if you fell down and got hurt and you went into a SNF and you had the first 20 days are covered by original Medicare, and then after that, it starts to be a co-insurance for every day you're there. Well, your Medigap, depending on which one you pick, can extend and help pay that co-insurance. Now, Medicare Advantage Plan overview. Coverage includes parts A and B, and usually D benefits under one plan. May cover services excluded by original Medicare, such as dental cleanings, but restrictions may apply. So, for instance, you could get a Medicare Advantage plan, say through Blue Cross Blue Shield, that says it has dental coverage. Well, that dental coverage, you need to look at closely to make sure you understand what it is. Because sometimes it really just offers routine cleanings, say once a year, and then a couple other benefits. But if you went into that dental coverage thinking you could just get, as fillings or crowns, root canals, you should look much closer to make sure that you understand the benefits fully. Oftentimes, the benefit is more at a surface level. Provider access. The beneficiary may have to see in-network providers in order to receive covered care at or care at the lowest cost. So if you had that same Medicare Advantage plan, it's going to be localized, sort of like the insurance you're used to having normally, that you have to see the doctors in their network, and their network are in a geographic area. And if you want to go see a doctor outside of that geographic area, you're not going to find coverage, and you're going to have to pay a lot more. Likewise, if you're just in the same geographic area, but you want to see a different doctor that's not in your network, you go to a specialist that's not part of your network. If you're an HMO and you don't get a referral or permission from your plan, most often than not, that's not going to be covered. Referral requirements. The plan may require primary care physician to referral to see a specialist. Just like we said, you're going to need your plan to give you permission to see the doctors. Costs. There's a limit on out-of-pocket costs, and the costs vary by plan. Medicare Advantage Plan coverage. Medicare Advantage plans must offer the same benefits as original Medicare Parts A and B, but can do so with different costs and coverage restrictions. For example, a beneficiary is required to get prior authorization for certain services. They can offer benefits not available in original Medicare, for example, coverage for dental cleanings or gym memberships. Individuals should contact the plan directly to learn about coverage specifics. Medicare Advantage Plan costs. Individual generally must pay the Part B premium. So remember how we talked about the Part B premium now is $170.10 a month, and it's going down to like $168 next year. Well, that premium is you're going to still need to pay that premium if you're in a Medicare Advantage plan, just as under original Medicare. Most plans have a deductible and then fixed co-payments rather than co-insurances. All Medicare Advantage plans must have maximum out-of-pocket limit. The annual maximum that an individual will pay in deductibles, co-insurance, and co-payments, $8,300 in 2023. The plan pays 100% of cost of Part A and B covered services for the rest of the year. The beneficiary may pay more if they don't get care outside, if they get care outside the plan's network or service area, as we said, or don't ask the plan's permission to get certain types of care, or don't follow the plan rules. Medicare Advantage Plan networks continued. In-network providers contract with the plan to provide healthcare services. Out-of-network providers do not contract with the plan. Certain plans may offer coverage for out-of-network services. In these cases, the beneficiary is normally responsible for a larger portion of the cost sharing. So if you've ever heard of what a PPO is, that's where You can see out-of-network providers, but usually the percentage that you pay of their service goes up. But that's going to vary, plan to plan. Because like we said, Medicare Advantage offers the same coverage as Original Medicare, but they make the rules of how that care is covered. Original Medicare and Medicare Advantage. This is sort of like a side-by-side summary here. Original Medicare. You can see any doctor that accepts Original Medicare. Medicare Advantage. There's a network of doctors and service areas. Original Medicare. No referral for specialists. Medicare Advantage. May need a referral for a specialist. Original Medicare. Does not include hearing, vision, or dental coverage. Medicare Advantage may offer additional benefits, including hearing, vision, and dental. Original Medicare, no limit on out-of-pocket costs. Medicare Advantage, limit on out-of-pocket costs. Original Medicare, can purchase a Medigap. Medicare Advantage, Medigap plans cannot be used with Medicare Advantage. Here are some resources. The State Health Insurance Assistance Program of California is the California Health Insurance and Counseling and Advocacy Program, or HICAP program. Their number is 1-800-434-0222, and there's the website for it as well. If you're calling in from another state, you can go on the internet and type in your state and then the word SHIP, SHIP, and you will find a link to your state SHIP. And your SHIP will offer you state-specific information regarding enrollment rules, because every state has different enrollment rules and regulations. So it's always wise when you're making a decision about changing your plan, or if you want to enroll in a Medigap, you should call your state SHIP. The Medicare Rights Center, and we're from the Medicare Rights Center. There's Medicare Interactive, which is a free online resource developed by Medicare Rights with answers to Medicare questions in clear and simple language. And if you go on that website, www.medicareinteractive.org, you can type into it like a search engine and find all kinds of flyers and articles that can help you understand what the rules are. And we have a national helpline that's 800-333-4114. And you can call between the hours of 9 and 3, Monday through Friday, and speak to a representative who can hear your issues and help guide you through them. Thank you so much. It's been a pleasure to do this presentation with you, and I look forward to hearing from you and hearing your questions.
Thanks so much, Max. We do have a lot of questions, so I'd like to get right to it.
Great.
We have one person who wanted to know, it was about the, okay, yes, about the penalty. Is there a way to waive the penalty, especially if the individual does not have the means to pay for this penalty?
Mm-hmm. Well, there's a program that exists in every state called the Medicare Savings Program. And the Medicare Savings Program is an monthly income based benefit. And some states also have an asset quotient to it as well. To qualify for this program, you would need to speak to your local Medicaid office, or you can also call your state SHIP, which is probably an even better way to try to enroll in this program. And if your income meets that criteria, then what the Medicare Savings Program does, it pays your Part B premium. It also enrolls you in a federal program called Extra Help, which is a prescription drug benefit, which greatly reduces your prescription drug costs. It also pays your Part D premium as well. If you do not have Part D, it automatically enrolls you in it. And it forgives your Part D your Part D penalty, and it also forgives your Part B penalty. So this is a great benefit that can take away all your penalties and start having the state pay your premiums from that time forward. Now, each state administers this benefit differently, and each state has different enrollment application criteria based on income, based on asset. So, for instance, I believe Arizona has no asset requirement for it. New York has no asset requirement for it, but certain states do. So it really depends on what your state has done in terms of legislating that. But that is a benefit that you should all go and check and see if you qualify for the Medicare Savings Program, and call your SHIP and say you want to be screened for this benefit.
Thanks, Max. We have another viewer who wanted to know how to know if they've been made eligible for cost-free Part A based on their work record or that of their ex-spouse.
Okay. So if you or your spouse or your ex-spouse has 40 quarters of work history, which is about 10 years, then you should have access to premium-free Part A. So if your spouse works and you don't, you can enroll in premium-free Part A through their work history. But where you find out how much work history you are is Social Security. You should go in and make an appointment and speak to them, or if you want to, you can also talk to them on the phone, though I think that a lot of people have a harder time communicating with phone representatives for Social Security. I don't know what your state Social Security offices are like, but for us in New York, we tend to find that going in person, you have a better result.
Thanks, Max. We have another listener who wanted to know, when a person who has Part A due to disability, do they have to re-enroll in Part B when they become 65, or is that automatic?
It's automatic. When you hit 65, or I think maybe it's the month before you turn 65, you're automatically re-enrolled. And it also forgives any late penalties at that point. When you go into your IEP for a second time, you get a totally fresh start.
Thanks. Now we had a question about Medigap, the Medigap programs. I wanted to know, can you sign up for Medigap after employer insurance is terminated?
When you first obtain Part B, you have 6 months. You have 6 months to get a Medigap without any scrutiny from the insurance company in terms of underwriting. So let's say you have a pre-existing condition. They can't look at that. They have to issue the Medigap. It's called a guaranteed issue right. But if you go outside of your Medigap enrollment period, so you get Part B and you wait more than 6 months, then it's up to the issuer of the supplement to decide how they want to administer it. They might say, well, you need to wait for a year or 6 months, or maybe they can change the price. They can change the terms. So, and that also varies from state to state. There are 4 states that allow you not to have any restrictions, that you can sign up for a Medigap any month at any time. You could drop your Medigap, get a new Medigap, and New York is one of them. Another one of them is Massachusetts. There are 2 more, but I don't remember them off the top of my head. But most states have their own particular rules regarding how that works. So it's definitely worth finding out if that's something you want to do, or if you have a Medicare Advantage plan and you have had it for a while, more than a year, and you want to switch to original Medicare and pick up a Medigap. I would again call your state SHIP get some state-specific information regarding the laws governing enrolling in a Medigap.
Thanks. And actually, we had a couple listeners who wanted to know if they could get the slides and the recording. And yes, we'll make sure to push those out to everybody.
Absolutely.
We have another listener who wants to know, can they buy Medicare Advantage plan to cover long-term care? And if so, does that mean they do not need to get long-term care insurance?
Oh, yeah, I think most Medicare Advantage plans don't offer that. I've never heard of one that does. Usually, long-term care is something you get as your own standalone policy. You would get that separately, and it's usually very expensive. But yeah, Medicare Advantage typically doesn't offer that. I mean, it would offer some of the excluded services that you can't get in original Medicare, like we said, like dental, vision, hearing, that kind of stuff. But again, you should really look closely, like what exactly are they offering, and are those incentives are things to kind of draw you in to get the plan. But you should really look closely to see what those are, and don't assume that because my Medicare Advantage plan has hearing that you're going to get the hearing aid of your choice, or because my Medicare Advantage plan has dental that I'll have dental coverage. I'm sorry, I know that that's a bit of a diversion from your question, but I guess my point is the extra benefits in Medicare Advantage would not offer something as robust and costly as long-term care insurance. At least I've never heard of it.
Thanks. We have another listener who wanted to know, they currently have Medicare Advantage. They'd like to switch to original Medicare and they moved to a different state. So they wanted to know if they're able to switch after the annual enrollment period due to the move.
If they move, they get a special enrollment period to switch their Medicare Advantage plan and get another Medicare Advantage plan or get original Medicare. So yes, if you move, that should trigger a special enrollment period that would allow you to either drop Medicare Advantage completely or get a new one. And if you look on the Medicare Interactive site and you type in special enrollment period chart, you can see a chart all broken down and all the different instances of the special enrollment periods that you're entitled to, including that one. However, just to be aware that if you're going to switch to original Medicare and you want to also get a Medigap, that's a whole new Rubicon to cross, and you should know what state you're moving to, what the rules are for getting that guaranteed issue right, so that you know what it will take if that's the decision you're making.
Okay, thank you. We have another listener who wanted to know, is it best to sign up for Medicare A, B, D, even if still working and covered by an employer, or should they wait until employment ends?
Okay.
Yes.
Great question. Yes. If you have employer coverage, there's really no reason to sign up for Medicare, especially Part B, because Part B is going to offer not exactly, but it's going to offer sort of a similar amount of health care that you would get through your employer. So it's better to delay the enrollment of Part B. Also, you're going to save the $168 a month in the Part B premium as well. Most employer coverage includes prescription coverage, and you need to ask and make sure with your HR that the prescription coverage offered is creditable with Part D. And that just means it's equivalent or better than Part D. And most of them are, but you still need to make sure of that, because when your insurance ends and that triggers that SEP for you to sign up for Part B, and you pick up Part D, your Part D is going to make sure that you had prescription coverage that was creditable with Part D for the entire time since you turned 65. And if it turns out that that prescription coverage is not creditable, then they'll say, okay, you didn't have Part D that entire time. So from when you turned 65 and your IEP ended until now, you have a penalty. So that creditable piece is important. But to answer your question, no, there's really no reason for you to take Medicare if you have employer insurance still. And that's why that SEP exists, so that you can wait until that insurance is finished to then get Medicare. There's one other little piece there, and that is that usually if you qualify for premium-free Part A, because you have the work history for it, then you'll get Part A. You can get Part A for free, and you can just get that, and that'll be there. You'll have that piece of Medicare ready to go. And it would be secondary to your employer insurance. However, if you have an HSA, a hospital, a health spending account that you make contributions to as part of your job, as part of your benefits, Part A interflicts with the HSA, and it makes it so that you can no longer use your HSA. Those two don't go together due to, like, I guess, the tax restriction. And so if you use an HSA as part of your work healthcare, you should not get premium-free Part A until you're clear of your employer insurance. But if an HSA isn't involved, there's no consequence to getting Part A early. But Part B would be an extra expense, and it would be, you should wait until your employer insurance is finished.
Thanks. Looks like we have time for maybe 2 more questions. We have a listener who wanted to know their husband, who is 55, is eligible due to a disability. They wanted to know, as the spouse, are they eligible to get Medicare if they are younger than 65?
It would only be for the person who has the disability. The spouse wouldn't qualify for Medicare through a disabled individual, just the person with the disability.
Okay, thanks. And I think we have time for, one more question. We wanted to know, a listener wants to know, does IRMA apply to just income from wages, or does it include retirement income?
Right. I think a lot of times what the IRMA looks at is 2 years prior. So they're going to look at 2 years prior at your tax return. And if that's when your income is past a certain point, they assign the IRMA to you. People typically, when they retire, their income goes way down. They're no longer making the salary they did when they were working. So they'll appeal the IRMA. And there's a form that you can sign into Social Security explaining how, like, this is how much I make now. You can include in your most recent tax return or an amended tax return if that helps explain why there was that added income, and maybe it's erroneous. Then yes, then you could then Social Security can evaluate that and then take the IRMA away. And yeah, so that's basically it. When you're retired, they're going to be looking at whatever income you're getting. So yeah, so if your retirement income is, extremely high, they could give you an IRMA based on that. But yeah, the IRMA you get is based on 2 tax years prior.
Perfect. Thanks so much, Max. It looks like we're out of time for questions. Could you let the listeners again know how they can reach out to your organization if
Absolutely.
they had other questions or they want to access your online tool?
Sure. So we're at 1-800-333-4114. 1-800-333-4114. We're the Medicare Rights Center. And if you look up Medicare Interactive, that is our online searching tool that has resources and flyers that can explain all the things we talked about today. So if you were taking notes and you're not sure what it all means, and you wanted to get it in writing so that you could see it clearly, please go to Medicare Interactive and look up your question, and I'm sure you'll find the answers.
But again, I think that's all the time we have for today. I'd certainly like to thank you all for joining us today. These webinars are free and continuing series. You can find out about future webinars at Family Caregiver Alliance's website, which is caregiver.org. So I'd like to again thank you all for joining us, and a special thanks to Max for sharing your time and your expertise with us today.
Thank you so much. It was a pleasure.
So, yeah, on behalf of everyone at Family Caregiver Alliance, I'd like to wish you all a good holiday season. I know we're all, many of you are caregivers, some of you are professionals, but whatever the case may be, I hope you're able to manage your holidays and it's not too stressful. And of course, we want to wish you also a happy new year, as we're just about to enter into 2023, surprisingly. So again, I'd just like to wish you all a great holidays, a great new year. And I think that's all we have for today. We hope to see you in 2023.